Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we'll be discussing the White House's Winter Playbook for nursing homes. Everyone has entered the meeting on mute, but we will have a discussion at the end of this webinar. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We encourage you to join us every Wednesday at 2 p.m. for more of these weekly webinars. Next week's topic will be Everything COVID-19, Your Questions Answered. That will be more of a Q&A style webinar about COVID-19. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest, Penny Imes. Penny is a quality improvement specialist at Quality Insights. She started her nursing career in acute care before moving into long-term care. Her positions in long-term care have included staff development, dementia unit manager, registered nurse assessment coordinator, and director of nursing. She found the perfect combination for herself at Quality Insights, where she is able to work in quality improvement with long-term care nursing homes. Penny, welcome, and thank you for joining us today.
Thank you. And Kathy, I'm afraid I'm late. Sorry, everybody. Thank you for joining today. I'm not sure about some technical difficulties. As you all know, because your time's valuable and I don't want to waste it on my technological issues. So anyway, we had talked to everybody. Oh gosh, what was that? Like the end of November when we came in. Patty was doing talking about one of her readmission work groups and how you could use QAPI. And I talked to all of you, or some of you who were on. Hopefully a lot of you were on at that point in time. Some of the same people. For those who weren't here on that webinar, you'll be getting new information. But we talked about how at that point in time, the White House was very focused on doing what they were calling a 6-week blitz and asking QIOs to get nursing homes involved in really focusing on bivalent vaccines for their residents and then the use of therapeutics. And the reason that they wanted to do that is because winter was coming. They didn't want to see another surge in, maybe some new variants, increased hospitalizations and deaths for especially nursing home residents, for all the population, but especially the vulnerable older population. So that was where we started. And many of you, if you had lower rates of bivalent vaccines right now for your residents, you've heard from a lot of our quality improvement specialists. We've reached out to you. We've asked you, this is, you're on the list for 25% or less, or 40% or less, or 50% or less, and share with us what your barriers, successes, all of that. So that continues. And that was part of the focus. These webinars then that we had through December into this month, in fact, up until next week, well, actually the end of the month, we're going to continue to focus a lot on talking about, winter preparedness, the bivalent vaccines and the therapeutics. The last couple webinars that we had, we went over making sure that you're reporting your vaccines correctly into NHSN, and here are some issues, the therapeutics and what you need to know about them. And so today we're going to be talking about the White House Winter Preparedness and Winter Preparedness, and then the specific Winter Playbook that they developed for nursing homes in particular, long-term care facilities. Some of what I'll be talking about is actually going to tie in a little bit to next week also, where next week, our Wednesday webinar, we're really, and I know we sent out an email. We told you what was coming with the question and answer. We asked for your feedback because next week we're going to have a question and answer session, and it's going to cover all things COVID. And everything, all these Wednesday webinars that we have been having from December through next week where we talked about guidelines and vaccines and therapeutics and NHSN reporting. We are giving you, all of you, an opportunity to join the webinar and to share with us your feedback on COVID and COVID related challenges that you're having, continue to have. Are there, share your successes also. So if there are successes that you're having, things that we can share. If you have specific questions related to anything that has to do with the COVID, with the therapeutics, with the vaccines, with the NHS and reporting, all of the things that the respiratory illnesses, all of those things that we've talked about over the last 4 or 5 webinars, next week will be your opportunity to come with questions for us. If you can send questions ahead of time, we'll be even better prepared. So that would be great. So anyway, I did just want to mention that, this kind of ties into that. Now I have to remember, okay, how am I moving my, sorry. Okay, I should have just not done the slides. How do I go to the next slide, Kathy?
So we're currently not seeing the slides. You'll have to share your screen again.
You know what? Yeah, this is just, you're not seeing them. Okay. Let me escape again.
Do you want to email it to me real quick and I'll share on my screen?
Yeah, why don't we do that?
Okay.
Because, and everybody, please bear with me for just a minute. It's really just, there are some topic highlights that I think would be helpful. So I'm going to just email that to Kathy really quick. So in the meantime, I mean, after this, and I'm hoping that some of what I cover in the playbook today will be, help you know, like maybe bring up some conversations, some questions that you could submit to us so that we can be prepared for, much better prepared for next week. Gosh, I don't remember what I called this. Oh my gosh, this is, thank you all for your time. Please don't think this is the way things always work here. I know we're always like, oh, join Quality Insights. We've got so much to help you with. And here I am being you know what? Let's just forget the slides. We'll do the slides. I will get these slides. What did I call? Oh, DCO webinar. This is our direct change order webinar. Isn't that amazing that that's what the slide would be called? Okay, here we go. Kathy, I'll send this to you. And then from now on, I will always let you be in charge of putting up slides for me, so that I don't mess it up. Okay. Are we still under the Medicare COVID waiver? Huh.
Is that a question for next week's webinar?
I'm happy to answer it. I'm just Medicare COVID waiver. Deb, do you have
I can answer that? Yeah, so we are still under that. It just came out and it's now extended till April.
Thank you. I wanted to apologize that I didn't know if that was updated. So that is out and it is extended. Okay. Thanks, Deb. All right. So Kathy, whenever you get that and you can put it up. But anyway, winter preparedness for the White House. And you can go ahead to the next slide. Where the topics are. I wanted to have the slides in front of you so that you can at least see what, with the Winter Preparedness Plan, which is the Winter Preparedness Plan is what the White House put out for healthcare and communities in general, just preparing for winter. This was from the middle of January, December 15th. And it was just reminding everybody to be prepared. I mean, COVID has sort of been incorporated. We know this last variant that there weren't all the hospitalizations and deaths that had been there previously, but they are still there. It is something that we all have to think about, keep in mind. And so with that in place, they wanted to get this out there for healthcare systems to think about, expanding easy access to that COVID testing, continuing to look at vaccinations, making sure you're prepared with personnel and resources, and then of course the focus on protecting the highest risk Americans, which are the population that we serve. And so really just to mention, although some of this isn't exactly nursing home specific, and Kathy's going to put into chat the links to both the Winter Preparedness Plan and also the Winter Playbook for long-term care facilities. So those links are in the chat so that you can go straight to these yourself. And like I said, that's why I just wanted to cover the main topics here. So really with expanding that easy access to free COVID testing, you know, and for ourselves, for our staff, for the community, not just for nursing homes, because of course we have COVID tests available, but they are making sure that there are free at-home rapid COVID tests still available through covidtest.gov. And all of this information, detailed information, is in the winter plan and the playbook. So if you click on those links, it will take you directly to the fact sheets for both of those. So I'm just going to quickly review some of these. The White House is going to make sure that testing is available at places for all Americans, for everybody, and that's the community. And then the vaccinations and treatments, that they're also readily available. We know outside community pharmacies, you can, you know, call your local Weis Market, other CVS, get scheduled, get the bivalent vaccine. Your staff can go out and stop and get it if they don't want to get it when you offer it. So there are all kinds of options. And then of course, working with your long-term care pharmacies. I think there were we all know there were a lot of issues, or some issues at first, with the pharmacies getting the supplies, getting the vaccines, getting the clinics set up, getting the vaccines to all of you. From our outreach to most of our nursing homes that we've been doing over the last month, we're finding that the vaccine access and supply is much better. If you are still having issues with that, please, by all means, let us know. We'll see what we can help you work out. But I think that access and getting the supplies and being able to hold the clinics is much better within long-term care. So, and again, we'll continue to reach out about the importance of getting the bivalent vaccines. I know some of the other things that we've heard with the vaccines are, you know, that people are just, there's the vaccine fatigue. And so, you know, we have the resources on the importance of getting the bivalent. And, you know, they had the primary series and they had to get 2 of those. And then they had another booster. And then this other booster comes up and it's like, is this ever going to end? But I think, you know, and there's new studies done. We have new resources that sort of show that this bivalent vaccine is working for the variants that they're having right now. So it is still a good idea for residents to have this. So if you're doing education with families, and I know some people were telling us too, some of the nursing home staff was telling us that, you know, some people were hesitant to have their loved one get the vaccine prior to the holidays because they were afraid there could be side effects, or they might not be feeling up to par. So they didn't really want them to go through that prior to the holidays. But hopefully now we're past that, and you'll be able to talk to educate families and residents again about your vaccines, and have them set up some clinics and have that happen throughout January, February, March, those months where we want to pay attention to all immunizations. And then the other one is preparing personnel and resources. And the White House administration was saying that they were going to work with states to make sure that they were ready to support urgent needs through clinical staffing, PPE supplies, technical assistance. So that's another reason why I say, because we all know staffing in nursing homes is already strained. It's our number one issue that we have. And believe me, we talk about that with CMS. We share that frequently. So these fact sheets and this information that's out there, make sure that you do pull this out so that you have access to where you can get the help. On this the CDC website, CMS, so that if you would have an outbreak and you're having additional issues, and that you are getting the assistance that you need. And then, of course, moving into the fourth topic of the preparedness plan is focusing on protecting those highest risk Americans. And of course, we think of our resident population because they're mostly within that age. They have a few more comorbidities. They're in a congregate care setting. And so, they face that higher risk of severe illness and death. And so the Winter Playbook, which I'll be popping up here and going over a few things on that will be something that would be important for you to have. And then also just, I know working with, and when we reach out, we say, do you need help with the vaccine clinic? What would we be able to help you with? Are you getting your pharmacies, are they sending the staff that you need to help hold these clinics? Because and staff at nursing homes are now, some of them are able to administer COVID vaccines. Just trying to rely on all the pools that you can to help with that. If there are issues, the White House is supposed to be working with all the state governors, with the Department of Health, so that if there are things that you need, and I know for Pennsylvania, pa.gov, Department of Health has their whole COVID website where you can reach out for information and supplies. So I just wanted to mention, and then of course for us at home, making sure that each individual, planning for yourselves, still following in your normal daily life and sharing this with your staff when they're outside of the nursing home in their normal daily life. I think we all need to be a lot more aware that these viruses are here. They're out there. We can become infected. Make sure that you're taking precautions. This is the time of the year when we start to see a lot of the respiratory illnesses. So if you're not feeling well, stay home. If you have to, don't run out to the grocery store sneezing and coughing all over everything. If you can avoid it, wear a mask, wash your hands, use sanitizer, all those things to share with families and staff as you educate them. And that's just kind of the outside setting of what you want to think about with winter preparedness. Then Kathy, what I'm going to do now is ask you to stop sharing, and then I'm going to pop up the actual Winter Playbook, and this one should come up correctly. So we shouldn't have to make you all suffer through my inadequate screen sharing. So then the other link to that, now this is the one that I said is more specific to the long-term care facilities. Can you all see it now?
Yes, seeing the Winter Playbook for nursing home and other long-term care facilities.
Yes. And so it talks about all the things that I said, and I'm not going to read through things, but it really is true that, for our older population, they are the ones who have it, their age, their comorbidities, being in a setting where you're with a lot of other people. You have visitors coming in and out, you have staff leaving, coming. They are more risk. And we don't want to see another variant that like COVID was at the very beginning. So we really need to think about all of that. Now, one of the things that we're also doing, we want to make you aware that we're doing on our community side is also talking to hospitals, developing resources for hospitals and pharmacies that they can put out there, that they can post, to ask them to try to, out there in the community, make sure that the vaccinations are getting done. If we have a poster on the importance of vaccines, and the local pharmacy has it posted, family members are going to see that. And then when you talk to them about getting the vaccine, they're hopefully going to say, well, I'm seeing this. Hospitals, we're trying to work with them on make this a priority in the hospital too, to try to give them the vaccine, or at least get the information so that you can share with the nursing homes, so that all of this isn't just left to the nursing homes to have to deal with. So we're also doing that work with outside of the nursing homes with the community. So some of the things, and these are things that we've already talked about. Of course, number one, helping your residents and staff to continue the education, help them access their updated COVID vaccines. And the playbook has some ideas, for how to do that. I'm not sure that there's anything new, except the one new thing that I did see here on this number 2 is there are newly available single dose vials. So there might be some situations. I know we have some short-term rehab, some transitional care units, places where the residents come and go within 7 to 10 days. And, you can't hold a clinic, you can't get the consent, hold the clinic. By the time you're ready to hold the clinic, they're ready to be discharged. And some of you may have some short stay population like that. So maybe looking at those single dose vials and accessing them might be something that would be helpful. And then just, like answering the questions and again, staff vaccinations, one of their suggestions is paid time off. Of course, I know, staffing considerations have to be thought about with all that. And then the treatments, and we did, you heard about the Paxlovid. We know there are some issues. There was somebody who shared with us that they had a dementia resident who could not swallow. You can't crush those pills. They couldn't swallow. They weren't, probably not giving it IVs would have been invasive. They might not have the veins for it, whatever. So they couldn't really do the IV treatment. There are always going, working in a nursing home, working with residents, there are always going to be outliers. There are always going to be people who might not be able to get the treatments. If you know that, those are the people that you have to think of different ways to protect them. And hopefully, we share that information, and hopefully somebody will come up with a medication that can be crushed and mixed in applesauce and will work. So those are the things we need to hear, that feedback from all of you, and we share that feedback. And but when you can, I had now this is my mother-in-law last year. She was 83. She started to develop symptoms of COVID, even though she had her vaccines. We got her on the Paxlovid. I think it was like day 2 or 3. And for her, it worked great. And she like her symptoms went away and she didn't have any other issues. So I've seen a case where the Paxlovid really does help somebody not get so sick. And we were really concerned. So it can work. So those treatment options are out there. And when you can use the treatments, we want you to do that and work with your pharmacy partners to do that. The other thing that's a little bit different that we haven't talked about yet is the indoor air quality across facilities. So that is something that the White House wants long-term care to really be thinking about, is, actions that you can do to improve your indoor air quality. And this was the one that probably for me was something that I know at this point in time I haven't really thought about. So with your environmental services, with your housekeeping staff, making sure that with your HVAC systems that the system is operating properly, doing those inspections, replacing those air filters. I know, in my house, we make sure we change those air filters every 3 months, get depleted air filters that really have good filtration. So it has ideas for what you can do as far as indoor air quality, because especially this time of year with all these residents, all these family members, they're inside, they can't go outside and visit because we're in Pennsylvania, it's cold. So West Virginia, still cold. So we have to think about, what can we do to protect them? And then there are portable air cleaners in certain areas. I know having ceiling fans turned on, exhaust, making sure you're using exhaust fans in the kitchen, share that with your dietary staff. And then I know this piece of it, I looked into this civil money penalty reinvestment program, and I don't know that Pennsylvania has a CMP reinvestment program, but West Virginia does. And when you click on this, it takes this link. It will take you to a site where you can contact, and Pennsylvania's on there with names and numbers of people you can contact if this would be something that you might want to look into. Like I said, I'm pretty sure that West Virginia has the option for some of this CMP. I'm not sure about PA. But just some different things to think about, like with the air, and trying to reduce the spread of airborne illnesses. So I actually, and on this form, it was something that I actually found interesting that I think, you could share with all of your staff, your housekeeping, your dietary, and make sure that these are things that you're thinking about for winter, to protect everybody while you're still in having to deal with COVID and all that. So that is, I see there's, oh, that must just be chat. That's the thing. So that is the information that I have to share. I appreciate all of you being on here, and I apologize so much for those issues that we had with me and the slides at the beginning of the presentation. At this point in time, are based on this, and I know we don't have a lot of time, we don't like to keep you longer than we have to, but make sure that you do get these links, pull up the preparedness plan, pull up the playbook, take a look, share it with your staff, make some plans for how you're going to address this. Try to make sure that your residents are protected as much as possible for this winter. And this will protect not just against COVID, but all those other respiratory illnesses that you have to deal with, the flus and the pneumonias and all that. These are good precautions for them also. So at this point, do we have any questions from anybody or comments?
Okay, yeah, if anybody has a question, please submit them using either the chat or the Q&A tool. You could also raise your hand if you would like to be unmuted to ask your question out loud. We don't have anything so far, so I was going to run through some reminders for next week. Next week's webinar, again, is going to be about COVID-19. It's going to be a Q&A style webinar. We're asking for questions ahead of the webinar. And you can also bring your questions to the webinar if you were coming next week. That's Wednesday at 2 p.m. And if you would like to talk further on these topics, but prefer a one-on-one discussion, we invite you to join us during our office hours, which are Tuesdays at 8 a.m. and Thursdays at 2 p.m. You can find the links to those live chats and all of our webinars in the newsletter we send out on Friday called the Last Minute Lowdown. And if you would like to receive that newsletter but don't think you're on our mailing list, you can email me at caudill@qualityinsights.org, and I will get you on the list. And I will drop my email and Penny's email in the chat shortly if you need to get in touch with either of us. Let's see. I don't see any Q&A. I don't see anything in the chat so far. And I don't see.
Okay, so hopefully this conversation triggered some thought. And if you have any questions, feedback, get them to us before next week, that webinar, and we'll be able to answer hopefully more questions for all of you. And thank you all very much for attending. It's really appreciate it.
All right. And just one moment before everybody leaves, I lost my chat window. Here we go. Here we go. There's our contact information.
For me, I don't know what to say.
I'm pushing all my windows around. I
started on Monday and it hasn't gotten. Yeah, no better.
Want to contact me, my email is caudill@qualityinsights.org. Penny's email is pimes@qualityinsights.org. Those are in the chat. And let's see, still nothing.
When you start working on a Monday morning and the first thing you have to do is restart your computer, it's probably not going to be a great day.
All right. So I don't see any questions. So if you have any, as I said, you can shoot us emails or come to next week. Penny, thank you for joining us again today. And thank all of you for joining us. We hope to see you back next week.
All right. Bye. Thanks.